Welcome to the Trilogy Talks Health Show, sponsored by Trilogy Home Healthcare. The home health experts at Trilogy specialize in meeting the needs of each of our patients. Our experienced staff provides services such as skilled nursing, physical therapy, occupational therapy, speech therapy, psychiatric nursing, respiratory therapy, and more. With our Florida offices stretching from Hollywood to Jacksonville, Trilogy can take care of all of your Medicare home health needs. You are our family. For more information, call us today at 954-689-6660.
Hello and welcome to our Trilogy Talks Health podcast, sponsored by Trilogy Home Healthcare. I'm your host, Jennifer Smith from Responsive Home Care, and we are pleased to have some very special guests to our show this evening. So here we go. We're going to welcome them right now. We have Dr. Friger. She's a radiation oncologist with us this evening. Hello, Dr. Friger.
Hi, hello. Thank you for inviting me.
Welcome. We have Dr. Ahamad, radiation oncologist as well. Hello, Dr. Ahamad.
Oh, hello. Thank you so much. It's such a privilege.
And we have our show sponsor, Stephanie from Trilogy Home Healthcare.
Good evening.
Thank you, ladies, for joining us this evening. We're here today not only to have you beautiful ladies on with us this evening, but to honor and celebrate International Women's Day and Women's History Month. And before we get started and I ask the questions, I'd like to take a moment to honor some women in history on this wonderful day. For example, Marie Curie, for her discovery of radium and polonium and her huge contribution for finding treatments for cancer. Martha Costin, who invented the maritime signal flares that saved many lives avoiding ship collisions. Mary Anderson, who invented the windshield wiper blade, which actually I needed today. Melita Bentz, who invented the coffee filter brewing system, which don't know what I would do without my coffee every single day. Stephanie Kollwitz, who invented Kevlar, the material used in bulletproof vests. And actually, my husband is a police sergeant, and I am very grateful for her invention. And Hedy Lamarr, who introduced the idea to develop Wi-Fi, Bluetooth, and GPS. I don't even know where we would be today without some of these just amazing women. So I think that, just Women's History Month in general and International Women's Day is a beautiful day to celebrate all women. And like I stated prior to this podcast, the job that the two of you physicians play and in general and in being radiation oncologists in this field of medicine is absolutely amazing. So I wanted to just have both of you, Dr. Ahamad, if you want to start by introducing yourself to our viewers, tell our viewers a little bit about yourself, and then we'll have Dr. Friger do the same.
Okay, thank you so much. So I am a radiation oncologist. I'm part of a large team that is necessary to take care of patients and treat them, whether they're curable or not, using our advanced techniques with radiotherapy. And I am part of the GenesisCare USA group, which is the largest global provider of radiation oncology. And my practice is based in Aventura. I also practice one of our services that we provide is radiation oncology services to the VA, serving our veterans. And I do perform work for the veterans, providing radiotherapy, creating their plans and treating them at the VA clinic in Miami. I am originally from Trinidad and Tobago, and I was trained in England under the Royal College of Radiologists, and then did my fellowship at the MD Anderson Cancer Center in Houston, where I became faculty as assistant professor. I then returned to Trinidad and worked in the international field in a developing country, providing services on building, creating new cancer centers and teaching. And then I returned to the US. I was the clinical director for radiation at the University of Miami. And now I am very privileged to be part of the Genesis group, providing radiotherapy services. And of course, although we're radiation oncologists, we always have to provide patient has many, many, many needs. So we have to include those among, whether it's communicating with them, helping them with the anxiety, or just helping the rest of the team, not just oncologists, but the surgeons and nurses and home health, helping them navigate through that pathway.
Oh, that's fantastic. Thank you for that. Dr. Friger? Oh, hold on, Dr. Friger, you're muted. There you go.
Okay. So I'm from Puerto Rico originally, and I did my training in San Juan. Later on, I did 2 fellowships in New York Medical College, brachytherapy and stereotactic radiosurgery. I believe that the radiation oncology field is a very diverse field. It was started by a woman, actually, Marie Curie. She did show that persistence is a very important trait, not only in women, in everyone, but she was very persistent in what she was trying to develop. And we had the privilege, as Dr. Said before, to be involved in this field. It's not only a field that affects the patient that is diagnosed with a malignancy, it also affects the whole family. So we have to deal with many factors, not only with the employees to be able to deliver the treatments, but also with the family members, and to be able to bring them daily with their daily needs and problems and symptoms. It is a very, difficult task every day, but we are here to help. I've been really in Miami since 1980s. I went to New York to do the fellowships, and then I came back. So I've been in this community for a long time.
Mm-hmm. Very nice. And Stephanie, I didn't forget you. Do you want to tell the viewers a little bit about Trilogy and why you're in the healthcare field?
Sure. So my name is Stephanie Houston with Trilogy Home Healthcare. I'm a representative that works with all of the community in Broward County, many different physician offices. And I love my job. I love helping people. Trilogy provides Medicare home health care to patients all over almost the entire state, from Broward County all the way up to Jacksonville, and many areas in Central Florida and the West Coast of Florida. And we provide things such as skilled nursing, psych nursing for things like emotional support, and physical therapy, occupational therapy, respiratory therapy, medical social worker, and many other services that we do provide, and it's fully covered by Medicare.
Very nice. Thank you for that. Dr. Ahamad, can you tell our viewers how radiation oncology got started?
Okay, so we have many people who were involved. Harry Becquerel, who later married Marie Curie, discovered radioactivity, and then she discovered the various isotopes and its effect. And later on, there were other scientists who noticed that if you placed a radioactive source onto a tumor, that it shrunk the tumor, just a skin tumor. And then over the past, this is more than a century ago, and over the past century and up to now, that has evolved into becoming a very sophisticated field. It's no longer a crude field where patients get radiation to portions of their body that may not need it or does not need it. We've been able to accumulate research data from all of the large hospitals throughout the centuries, and now we are more aware of how radiotherapy, how the tissues respond to radiotherapy, and what is the appropriate dose, what is the lowest dose we can go to and still have an effect on killing cancer cells. The other big evolution that now plays a major part is computing, because computers do much of our calculations now, all of our calculations, I should say. What my computer will do to produce a replica of a tumor so that the tumor is covered with the dose and nothing else gets damaged. What that computer calculates in 20 minutes will take about, maybe 5 years for me to calculate. It's very complicated. And you remember, we cannot bend a beam, but we have to avoid organs and go around those organs. So it's a very, very sophisticated computing algorithms and what we call calculation engines that have gone into it. So we have to credit those people. And the other group of people, of course, are the physicists. And they are the people who specialize in we have to understand physics, and we have to understand statistics, and we have to understand the body and the anatomy and how radiation works. We have to understand all of the cancers and patients and how to treat it and what dose and what technique. But the physicist specializes in the interaction of radiotherapy with tissues and how best to verify that what the computer has calculated is actually correct, because you can't see radiotherapy, and how to ensure that everything is delivered safely. Those are our physicists, and they have evolved along. And then there's also engineering, because we had linear accelerators developed in the 60s, which is the ability to create a beam that goes with such high energy that it goes through a patient's skin, doesn't interact with the skin or the tissues under the skin or give up any energy or cause effects on the skin, but will go through to a particular depth that we needed to go to. So you can treat a patient with prostate cancer and have a very high dose that will kill the cancer cells with 95% chance without causing any damage to the rectum or the bladder or all of the structures that sit next to it, and causing zero reaction to the patient's skin. And that is a feat of physics, radiation oncologists, engineering, and computing. So advances in engineering has that linear accelerator we still use, but it has evolved into now we can ablate, completely destroy cancer in areas like the brain and the lung and the liver without destroying anything else and without the patient even having surgery. So it has evolved and it continues to evolve. And one of the challenges that we do have, along with all the other radiation oncologists, is to keep up our knowledge with what is the current best practice, not just in the US, but throughout the world. So we adopt those for the benefit of the patient.
That's very impressive. Wow. And I appreciate that you spoke about it in a way that, like the layperson can fully understand what you're talking about. That's very impressive. And I know that, your company, former company, 21st Century Oncology, becoming GenesisCare has allowed your physicians and oncologists the ability to use this technology locally, which is really also quite wonderful for your patients as well. So that's, wow, very impressive. Dr. Friger, what made you choose a profession in the medical field, particularly radiation oncology?
Radiation oncology, as I spoke initially, is a very diverse field. You can not only treat patients with external beam radiation, you can also do what we call brachytherapy, which is inserting in certain cavities of tumors radioisotopes utilizing applicators or needles. Now, we have evolved a lot, as Dr. Ahamad was explaining, with our external beam capabilities, with the linear accelerators, that we can treat very small tumors at different depths without creating toxicity, grade 3 toxicity, or problems to the patient that will last forever. We should treat a patient without causing or creating a toxicity. It should be tolerable. We should treat the cancer cells, but the normal tissue should remain functional. And that's one of the situations that we have improved a lot on with the technology and softwares and the calculations, which are done daily. It's thousands of calculations. And as the doctors I was explaining before, it took a long time. This was not available years ago, and it was really marking the patient on the skin and treating them with in different modalities that were available at the time. Now it's just amazing that we can even treat a patient with external beam, actually looking on treatment position what the area that we're treating. And this is just incredible, the advances that we have been able to experience and enjoy, really.
Mm-hmm. That's wonderful. Absolutely wonderful. So, Dr. Friger, what types of tumors do you treat specifically or typically?
Yes, the practice that we have here in South Miami-Dade, we treat solid tumors or areas that are localized. It's not that like other disciplines that use other medications, let's say chemotherapy, that are systemic. We can and we should limit the doses and the treatments depending on the type of tumor. Doses vary, fractionations vary, and techniques also, but it's localized areas that we treat.
Okay. Dr. Ahamad, what are some challenges, if any, you face or faced navigating your way through what can be considered a male-dominated profession like radiation oncology?
Well, some of that is funny. We all have stories with having gone through residency and then become assistant professor and then associate professor and become clinical director, and worked internationally and was the advisor to a minister of health. And then you walk into a room and the patient says, well, I thought I was going to see the doctor. So you have to laugh and say, you're going to have to settle for me. And if you look a little youngish, I have people say, are you the doctor? And I say, yes. I said, did you go to medical school? And you have to take that very funny and laugh with them. You don't look old enough to have gone to medical school. And so you laugh with them. And they said, honest, are you the medical student? Because I wanted to see the attending physician. You really can't argue with them. You have to be polite. It's from the part of their culture. It's part of some of it is whatever the age is. Like, if they grew up maybe in an era when you didn't have a lot of physicians, or physicians didn't look the way we look now, or, you didn't have this diversity of people serving you. So that's, it's often very, very funny. Globally, I think if we look at a global scale, we're pretty ahead in the country and within GenesisCare, my group, and within all the groups that I've worked at in England, in Houston, in Trinidad, and Miami, and now with GenesisCare. In that there are some countries where women aren't even allowed to get an education or to go to school or to speak publicly or to speak for themselves. They're not allowed to do many things that we take for granted. They have a very clearly defined and narrow role. And certainly you're not, in some countries, a woman won't be able to see, male patients. Various countries, women from very young age is taken out of school to work. So I think we're very fortunate that we have opportunities that globally is pretty good when you compare it to the world. Countries like the US and most developed countries have moved ahead where, discrimination based on difference, whether it's gender, whether it is race or ethnicity or sexual preferences or, age, discrimination is clearly banned in companies like GenesisCare. We have very strict policies, and we have a lot of education of the staff on how to detect it and how to implement these policies. So we've reduced that within our group for sure. But taking the country as a whole, Some of it is actually illegal, and because of litigation, some corporations within the U.S. They have forced to treat everybody equally. But still, we have to acknowledge that there is a more subtle sort of micro differences between the way females are treated and the way males are treated throughout the country and in all fields. So we do have to acknowledge that. We can't say that everything is perfect, because we've come a long way, but we have a lot of work to do, especially because very often the person who is doing it or perpetrating is not aware of it. It's very subtle, and they themselves don't have insight into the fact that they're treating this person, whether it's been the attention that a question gets, or the attention that a request gets, or prioritization of a concern. This is very common within our country, within our community. And so we have to work with it. We have to be aware of it. We certainly cannot let it hold us back. We cannot. We can choose to stand up for ourselves in a way that doesn't damage the relationships that we have, but we should not let that hold us back. We know it's there. Let's acknowledge it's there. Let's be alert for it. If in any way it's holding us back, we need to address it. So I think it's there. It's going to take many years, because people who are in charge of many areas grew up in different cultures, different era, and don't even know what they're doing, that they're being discriminatory in their behavior. But I think we're well ahead, and we're well on the road to non-discrimination.
I agree. Well said. Definitely. Dr. Friger, what would you say is most important in your field of medicine?
I believe it's to get adequate information. Now we have the means of, with the internet, to look at websites that are scientific, that give appropriate information, not only to us, also for the patients. Patients should also be educated to know their condition, to get information. They won't understand everything. You cannot become a physician in 15 minutes, but at least to get information, so when you go to the physician, you can really put the pieces together, so they can understand at whatever level, whatever they have. But information is power. They have to understand, they have to know what's happening to their bodies, what may happen, if there is any possible side effect, if there is, what is the difference between one type of treatment or another. But it's mainly the information they have to know, not specifically maybe from A to Z, a pathology, or understand what the radiation will entail, but to understand at any level, at their level, what's happening and what type of options of treatment they may get, which are the possibilities of cure or controlling the tumor or palliation. There's treatments evolving and techniques every single day that we have to be reading. We as physicians have to be updated with the information continuously, and patients should do the same, not with the scientific information maybe, but with the information on their bodies. If there's something happening, something that is new, you palpate something that you were not born with, you should get it checked. And it's mainly just to get information. It will give you a lot of power.
No, I agree with you. I have worked in different fields of healthcare, and I have spoken with multiple different family members, some of my own, and I feel that a lot of family members, it's always the fear of the unknown, so they don't want to know. And they just kind of leave it out there to kind of not want to know what's going to happen and just kind of hope for the best. And that's the worst thing you can do. I've had it where friends have been caught off guard when things get really bad, and they say, well, oh, my mom never told me it was this bad for my brother. And it was, I think it's that fear of the unknown of, or the fear that they didn't want to know the information. So they didn't ask the right questions, or maybe they were told and they didn't want to hear it. So for me, I'm like the nosy person in my family. So I'm the one that's always asking the 50 questions about every little thing and wanting to know all the information. So I'm not the one that's caught off guard, but there are so many of, I have a friend now that it happened to his brother, and, he was caught completely off guard. And I don't want to be that person. I would want to know what was going on with my health or my loved one's health, and know every single option or whatever, for my loved one. Mm-hmm. So, if cancer is a scary word or tumor is a scary word. And for me personally, I would want to know what is A, B, C, D, all of those options, and better prepare, everybody. So, doctors, what advice would you give to any little girl or young woman who could be contemplating what to do with their future, whether it be become a doctor or become, or run for office or anything out there in this, considered male-dominated world? Any advice you might want to give to any girl out there? Either of you?
Well, Dr. Friger, you want me to go first? I guess. I would say, in planning your future, that you really want to, your plan for what you want should be very individualized to your own passion, to your own abilities, to your own strengths and opportunities, and to aim in the long term to be happy, to do a good job, and of course to earn an income. We have to be practical about this. For women specifically, I would say be aware that you are going to encounter, and be alert that you're going to encounter being treated differently. You may not have the same opportunities, or you may be looked at differently in approaching different roles. I would say to be aware of it, one, but again, I would say don't let it keep you back. In fact, I was not aware of anything. I didn't even know what my race was when I was in England interviewing for my residency. I didn't know that I was different, because in Trinidad, we are very integrated. So everybody's, we have a lot of races and religions, and we live together. So I wasn't even aware of the biases. I never saw, in fact, I never thought that I would be ever discriminated. And because I didn't know, I never saw it. I never felt it. I could look back now and see, oh my goodness, how could I have approached that person asking for this ridiculous request? So it worked in my favor, because I opened doors for myself that I knew, if I knew who I was, I wouldn't think that door is openable. So, but for people who are for females that you're addressing specifically, you should be aware that these things, this is discrimination. It's very similar to discrimination based on other, meaning that you're treated differently, but not to let it make that person an enemy. That's not, you don't have to become friends, but you don't make that enemy, because that's going to close doors. So one of our lecturers once told us that there was a cardiologist that absolutely treated the students awful, and he was horrible. And when they went to the dean said, listen, you don't need to be his friend, and you don't need to like him, but you got to use him to learn all your cardiology. And so I would say the same thing. You get the best out of people, because everybody has something good in them. And if you don't walk away because necessarily if you're being abused in some way, that's different. But if you're just being discriminated against, it's not necessarily a reason to walk away and drop that opportunity. Find a way to deal with it, find a way around it, and move and keep moving forward towards what you're passionate about, what will make you a happy person. And therefore, if you're happy with what you're doing, you're going to do a good job automatically, and something that will earn you an income so that you can support yourself and help others.
So what I would suggest is that you determine what is it that you want to do in the future, that it will take 30, 40 years that you'll be working every day. In Puerto Rico, in my residency, we were fortunate that we had about the same amount of women and men. In the United States, when I came to do my fellowships and work here, Miami is a very diverse community. But for example, in New York, the accent was a problem for some of the colleagues. I really didn't care because my signature was as important as them. I don't think with my accent. So I have my own brain, and brains are the same everywhere. It has the same color and they work more or less the same if you have an education, of course. So I really didn't pay attention, as the doctor said, of what was happening. I just addressed it at the moment and I just kept on going. I learned a lot. The director of the program was Greek, and he was Dr. Basil Hilaris. He was a pioneer in brachytherapy of the prostate. He was not discriminatory at all. He had the same accent I had, more or less. So to him, if somebody said anything to a female doctor or a nurse, it would really upset him because we really are the same. Our organs are the same. We just have to address it, I believe, at the moment in a very professional way, and just learn, as the doctor said, whatever you have to learn from everybody, and just keep going, because you're not going to go with them to home and you're not going to marry everybody. You just learn from experiences, or you learn subjects, and that's it, and then you go home.
I think that's wonderful. What you're saying, it reminded me of a quote that I actually sent to a friend of mine who was struggling this past week. And it says, there's a purpose for everyone you meet. Some people come into your life to test you, some to teach you, some to use you, and some to bring out the very best in you. And it's true, you know, so thank you for that, ladies. And moving on, this is a great time to explain how GenesisCare and Trilogy Home Healthcare can work together. So maybe Stephanie or the doctors can talk about like a scenario of how GenesisCare and Trilogy Home Health kind of work together.
So one example would be a patient who's going through therapy for their cancer diagnosis, and maybe they are struggling emotionally, which I would think would be quite common. And so they would need an emotional support nurse, a registered nurse, also known as a psych nurse, to help them through this time. And also they may not know where to turn for different resources. So a medical social worker can help them, maybe if they need like a lifeline button, something like that in the home. Maybe they need help with veterans benefits. A medical social worker can be very helpful. And then also physical therapy or occupational therapy, or both, that can help with strength and fall prevention. Maybe they're a little bit weak and they need to work on their strength and balance, things like that. And those are some of the ways that we can help patients from Genesis.
Point of view, we recognize cancer care, high quality cancer care involves a team. We as the physicians cannot do it on our own. We have our professional team, surgeons and gynecologists and urologists and all of that. But the professionals mentioned that we can access through Trilogy, very essential, not just for patients' quality of care, but to their survival. We treat them, but we are thinking of their survival and their quality of life. And so a patient who is depressed or who is upset or who's confused, or remember, going through cancer is one of the most stressful. Your life is threatened, whether you have a tiny cancer or a small one, a big one, you're feeling like your life is threatened. So it's one of the most stressful experiences. So a health professional that they will provide, a patient may go home and there's an ulcer, or there may be something in the lung that needs physical therapy. That is as important as the radiation or the chemotherapy. Same thing with a speech therapy for somebody that we've treated the voice box, having occupational therapy. You don't want, if the patient goes through weeks of radiation and months of chemotherapy and then surgery, and they have not been very active, that patient can lose normal function of their life. You want them to go back to their life. It will be a different life, but you want them to go back to their life. We really have not been trained in doing that as a physician. We know they have to, but we cannot provide what the occupational therapist would do and what the physical therapist is going to do and what the speech and the therapist is going to do, or the nutritionist. We cannot provide that. We can just ask for it. And the benefit of Trilogy is that they will go to the patient's home and provide this in the comfort of the patient's home. So they're a very important part of our team in our goals, accomplishing our goals, which is a high quality care, so teamwork and multidisciplinary input, all of those professions that Stephanie listed, and then survival of the patient, function of the patient, and quality of life of the patient.
Absolutely. Making sure that they're not missing appointments, getting their energy conservation to make sure that they're able to continue about even in their own home, making sure they're getting back to their radiation appointments. All of that is key. So it's all about keeping the patient as healthy as possible, continuing their journey through their treatment, giving them the best quality of life possible. It's all about just keeping the patient as healthy as possible, meeting all of their individual goals as a team. So very well said. And before we say goodbye to everyone, I think this was a wonderful show. I want to have the doctors and Stephanie just tell the listeners how to get a hold of them. So Dr. Friger, do you want to start? There you go. Let's unmute. You're muted. There you go.
Okay, can you hear me now?
Yes.
In radiation in South Dade, they can call us at 786-439-3779, and we will evaluate most of the time all the information before, so we can tailor the treatment and evaluation for the patient. Most of the time we have to coordinate other services at the same time, because if the patient is sent to us with too close to the time where we should start treating the patient, then we have to coordinate other specialists too. But they can call us at 786-439-3779, and we'll be more than happy to evaluate them. Thank you.
Dr. Ahamad?
So any patient who requires radiotherapy or an opinion will call our office in Aventura for patients in that region. And it's 305-692-1100. Very often we get the patient doesn't refer themselves, but they come from surgeons, or they come from medical oncologists, or they may come from the dermatologist or urologist, who, if they think that the patient needs an opinion regarding if they will benefit from radiotherapy. That's the only reason we would give patient, is if it benefits them. And if they can ask to be referred to us. My name is on the screen. My last name is Ahamad. And then they can, if the physician needs a fax number, it's the same number that the physician office is called, 305-692-1100, to send the referral through or to send the patient through. So it is a big team, and the team really needs the contact information so they can share that with their physician if they would like to be managed and cared for by GenesisCare. And then if the patient needs any of the services of Trilogy, I am authorized to refer the patient to Trilogy to access those services.
Thank you. Stephanie? Oh, hold on, you're muted. Let's get you unmuted.
Am I on now?
Yes.
Okay. My cell phone number is the best way to reach me, and it's 954-914-2970. And I can take calls from physician offices, from family members or patients that may just have questions about home health. I'm primarily in Broward County, Florida, but I can take calls from anywhere. I'm always happy to help. A lot of times I talk to family members who live out of state or sometimes even out of the country that are not sure what to do or how to go about getting help. And I'm always available to help or at least point you in the right direction. If it's not a Trilogy question, I can always help direct. So thank you.
Perfect. Thank you. And again, I'm Jennifer Smith, your host from Responsive Home Care. We're a private duty agency located right here in Broward. We'll be celebrating our 27th anniversary. And you can reach me at 561-670-9213. And it's been my pleasure having you wonderful ladies on this evening. And again, happy Women's History Month and International Women's Day. It's been our pleasure. And I hope to see you all very soon.
Thank you. Thank you for having me.
Thank you so much. It's our privilege.
Absolutely. Have a great evening.
Thank you too.
You too.